You're a year 3 medical student, so you're one that is full of hope, at least for how health, public health, and clinical healthcare is heading in the future. Some comments from you on the use of digitizations and AI.
So I feel like when you talk about health, right, there are 3 layers of prevention. Primary prevention, which is education; secondary prevention, which is like screening; and tertiary prevention, which is basically when someone who's sick comes into the hospital.
I'll stop you there. It's fantastic hearing a medical student talk about the 3 types of prevention that is very much the foundation of public health. Over back.
But education's no use if it doesn't get action.
Oh yes. Back to you, Thaarun.
So yeah, like tertiary prevention is when someone who's sick comes into a hospital and we treat them. And technology has a role to play in all of these. For example, right, when we talk about primary prevention, things like social media, Instagram, all of them can help educate the public. And a lot of the population right now is youth, and they don't communicate via newspapers, they talk via social media. And thus we can tap on these avenues. And this itself is a form of technology. And what I do see is when we talk about technology in healthcare, a lot of people think it's like, AI for using for diagnosis and stuff like that, but not really. Simple things like digitization of medical records, using automated machines to bring stuff from level 7 of a hospital to level 1 of a hospital. All of this is technology. And we can tap on all of these creative avenues. So I recently worked on a project which involves using AI to tackle a wide variety of problems. One team was working on things like diagnosing brain tumors, and one team was working on optimizing queue for medical clinics. So there are a lot of things we can achieve using technology, and what this serves to do is effectively reduce the stress on the most important healthcare resource, that is the doctors themselves, as well as the other allied health professionals. With the population becoming an aging population, the burden on healthcare workers is going to increase. Technology can reduce the strain on them, and in turn this will help improve the quality of care being delivered. So I feel technology is super critical, and we're just skimming the surface of what is unlimited potentials. Thank you.
Thank you, Thaarun.
Just want to perhaps make some comments as well. We've seen technology being used in many different aspects of healthcare, and it has come to the fore, particularly in the last 3 years in relation to managing COVID. I've seen technology applied in several different themes. The first of which is in terms of care substitution, care displacement, particularly where resources are lean in certain areas, manpower challenges that we have. We attempt to use technology as a means of trying to overcome these challenges that we have. Then we have seen technology being used to change the care model that we have, particularly with the view towards improving outcomes or reducing harm. And that may be in various ways, going into precision medicine. Sally Davis, when she was chief medical officer, was a very strong proponent for gene banking, for the adoption of national precision health strategies. These are important because they bring technology to the fore and allow us perhaps to tap the potential of looking at individualized treatments that may improve outcomes ultimately downstream as well. We've seen also technology being used in many other ways, but one important enabler that we must not forget is technology is opening up